Hi guys, welcome back to the channel. It's Fatima here. All praise to the Most High for bringing us together again. Shalom, shalom everyone. So just going to dive right into it, guys. Just a little health update about COVID-19. The disease is still out there. It's still killing people left and right. So I just wanted to let everyone know to go over to the CDC website and order your free test kit for the COVID-19. Okay, I think they're giving out like 4 test kits per family. It's quite easy to do. You go over there, CDC, and you fill out your information. It asks just your email address and your name and address, and they will mail you out 4 test kits for COVID-19. COVID-19 is usually a respiratory illness, but it can actually cause more damage than that. Further studies are showing that up to 3 years after having the initial COVID-19, there's wear and tear on your heart and kidneys. So there are long-term effects of COVID-19, guys. So you definitely want to try to avoid, if you can, getting the illness. But if you do get it, you want to go see a doctor and start taking that antiviral medication that they have now for the illness to hopefully slow down whatever type of illness is going to cause in your body, or ailment is going to cause in your body. So just wanted to just give you all that tidbit. Please don't sleep on it. Go over to the Center for Disease Control, CDC, and you're going to go on that page, and this is how the page looks, guys. It's blue and white, so you want to make sure you're on the right page. Unfortunately, there are websites out there, and they're charging you. You don't have to be charged for those test kits. They're free. The Center for Disease Control are sending out free test kits, 4 per family. So if you have 4 children, have all of them. If there's 4 different households, 4 different addresses, tell everyone to go and get their test kits, because you don't want to play with this thing. You don't want to be sitting at home with COVID and thinking it's the flu. If you can get tested within the first time you have the symptoms and it tests positive, go ahead and go to the doctor so that they can start you on this medication to go ahead and combat it. Because for some people, without medication and help, you will become deathly sick and you can die from it. So it's no joke. And that strand, guys, is getting stronger every 6 months. I mean, I looked at a list. The strand list is this long. It has a number, a name and number by it. It just keeps going. So this is here to stay. This is not going anywhere. They give you medication, and I guess it really doesn't kill it, because obviously we're still 5 years in now, and we're still talking about COVID-19. Let's not sleep on it. They are recommending booster shots every 6 months. I, for one, need to go take a couple of shots. I think I've only taken 2 since they started. After reading and doing my research, I think it's best that I go ahead and catch up on all the shots that they have recommended and also do a booster shot. That's just from my in-depth reading on it. Because after learning now that, and I've had COVID before myself, and it was no joke. I did not enjoy having it. It's been a couple of years back, but I was very sick, and I had the flu before, and COVID was 10 times worse than the flu, I thought. But there was no medicine to take. Within 14 days it was gone or whatever, but it was not a good feeling to have. But I was saying, they're showing now that you can have up to, after getting COVID, up to 3 years afterwards, it's still doing damage to your kidneys and heart, possibly. So there are people who have what they call the long haul COVID, and they end up getting disability or becoming disabled from it. So let's try not to get it. Let's I think everybody should be practicing social distancing. If you're going to grocery stores and shopping and movies, I think you should be wearing your mask, guys. It's just, I would, if I was going to a movie setting, I would be wearing a mask. If I was going to out shopping, I would be wearing a mask. It's just, I think that it's just best because it is up and on the rise. It hasn't gone anywhere. It's getting stronger and stronger, and there is no end to it. So you want to just keep that in mind, especially for those who are already at risk, who already have weaknesses and sicknesses in their body. You don't want to take a chance. And it doesn't mean having a mask on and it's just down below your nose. No, that's not proper. If you're going to have a mask on, have it across your nose, across your mouth, and tightly as possible. If you're going to wear a mask, wear it properly. But that walking around with a mask on and it's down past your nose, you're still going to breathe it in. It's airborne. You breathe it in, guys. There is no, you ingest it in and you breathe it in. You can, your hands are contaminated. If your food is contaminated, whatever. You want to just, if you're going to try to wear a mask, I just say wear it correctly, because you see a lot of people, well, just wear the mask correctly. And, but I do suggest that you do that. Just based on the studies I'm seeing, and the amount of deaths that are still occurring from this, we should still be practicing the initial steps they told us: hand washing, social distancing yourself from, don't be all up in people's face and everything. Just kind of be back away and wear a mask. So social distancing. I think is key. I really do. But I just wanted to just drop that out to you all. I'm always trying to drop gems, but the main thing is just getting those test kits. And as soon as you know that you have it and you test positive, go to the doctor and see if they have medicine they can go ahead and start you on and help relieve those symptoms much sooner. And then hopefully in the end you won't be one of the ones that's lying up there in the hospital near death because of this disease. It's not going anywhere. It's in the air, and you just want to try to keep from getting it, guys. So just wanted to share that with you all. I hope that's a good tip. Please share it with other people. Not necessarily share my video. Great, you can share the video, but share that they need to. That it would be great if they go over to the CDC website and get their free test kits for COVID-19. Goodbye, guys. Thank you. Shalom, shalom.